medicine's very humbling, and that all of us will be humbled at points in time. But there are some things that I think are important rules to consider, and that is that, getting second opinions about neurologic problems that are challenging is a sign of strength and not a sign of weakness. And I think that is really, a key emphasis, that, you should always be willing to be humbled and to learn more about the problems that you think you know a lot about, but you may not know about that particular patient, because sometimes it's that particular patient who really determines what that disorder is, right? Because not everybody's going to want to be treated the same despite having a very similar condition. So I think it's important to read your patients. And, when you're in a conundrum about what to do with the patient, I would listen very carefully to what that patient's desires are, because they often lead you out of that, decision tree that you're struggling with. They often have a good way of viewing, what their options are. And then in terms of giving lectures and giving talks, I think it's important that you have fun, that you make sure your talks are short, because no one ever complains of getting out of a talk early. But they will get very upset when the talk goes over. So you can ruin a great talk by exceeding your time. And I think that, would be a good educational pearl. And the other thing is, how do you avoid saying ums and ahs in a talk? Well, you got to breathe. And so there is power in the pause. When you pause, you can draw the audience in further, and you also can modulate your speech. And I think it's important to give a roadmap of where you're going to go with your talk, to try to let people know where you're headed. That's very, very key as well. But I think having enjoyment, because if you're having fun, then it's a possibility your audience might be having fun. And also always look at people that are awake, right? And people there's always a few head nodders in there. And it's always good to get some sense that somebody's appreciating what you say, even though it might be a reflex in that person. But so those would be some of my education pearls. Regarding leadership, I think that the most important thing about leadership is recognizing that at that point that you're assuming that role, that it's not about you, but about everybody else. And there is great reward in trying to help others succeed. And so you should think less of yourself and more of the other people that you're leading. I think that that's really key. And if you're not at that point, then maybe you shouldn't take that leadership position.